All right, thank you for joining us for this month's meeting of the CTeL Telehealth Working Group. A couple topics to go over today. One is discussions heating up around a potential second reconciliation bill in Congress, as well as the fiscal year 2027 appropriations cycle also getting underway in Congress. In the administration side, a couple new announcements from CMS to go over, one of which is a new announcement as part of their health tech ecosystem initiative, as well as the first round of participants in CMS's new access demonstration model. And so to start with reconciliation 2.0, as a lot of outlets are calling it, um, of course, last year, the One Big Beautiful Bill Act was also a reconciliation bill. Um, this is because there are special procedures in Congress that allow a party in the Senate to pass a bill with a simple majority rather than needing the 60 votes needed to break a filibuster for normal legislation. This does, of course, come with certain limitations on the kind of policies that could be included in a reconciliation bill. But these procedures are often used by simple majorities in Congress to pass a lot of their financial priorities in legislation. There has been efforts to start a second reconciliation progress process since early January, and these efforts have picked up as the current shutdown affecting the Department of Homeland Security continues to drag on into its third month. Um, Congressional Republicans are looking at reconciliation as a possible way to bypass the need for the 60 votes and to reopen the agency. On the right is a post from President Trump talking a little bit about his desire to see another reconciliation bill to specifically address this policy issue. However, there are a number of other policies that congressional Republicans weren't able to get into the final One Big Beautiful Bill Act last year, and that there is an interest in bringing back during a second reconciliation process. On the healthcare side specifically, this will be another area, just like with the One Big Beautiful Bill Act, that congressional Republicans will look to make cuts in order to offset increased spending in other areas. Back in January, the Republican Study Committee, a group within the Republican Conference, published a document going over their priorities for a second reconciliation bill, policies that either didn't make it through the first time around or new policies that should be prioritized. Um, a lot of these are proposing more Medicaid cuts in addition to those that were already passed last year, including expanding site neutral payments and restricting a lot of eligibility for Medicaid funding and services as well. We don't have a draft bill yet in terms of reconciliation. There's a potential for one either this week or next to come out, and whether the scope it goes beyond just addressing DHS funding and includes these other policies may also affect how fast it moves through Congress, as well as what the dynamics around whether or not it can pass both with the slim majorities in the House and the Senate. Any questions on potential second reconciliation process?
No.
And this is something that we'll continue to track and provide updates to members as well. Similarly, the appropriations process for the fiscal year 2027 budget is picking up. This is usually around the time that congressional appropriations committees begin drafting their agency's appropriations bills for the coming fiscal year. This process usually starts with the White House's budget proposal. These are typically more an indication of the administration's priorities and wants from a budget. And it is very rare for the final budget that Congress actually passes to reflect the president's proposals. A common saying is that the president proposes and Congress disposes. But nonetheless, these still provide some insight into what the administration's priorities are for the next year's budget. Specifically on the HHS side, White House is calling for a 12.5% cut to the overall budget for the Department of Health and Human Services. It's proposing to eliminate and consolidate a number of programs, such as AHRQ's digital health portfolio. But it is also calling for a $20 million investment for a chronic care telehealth centers for excellence program, as well as an $8 million investment in a telehealth nutrition services network grant program. These were listed under the Make America Healthy Again section of the administration's budget proposal for HHS, and are likely a reflection of both the White House's and Secretary Kennedy's priorities for its MAHA work. The House Appropriations Committee is meeting on Thursday, so just in 2 days, to discuss the initial framework for its HHS appropriations bill. And Secretary Kennedy will be making an appearance at that hearing as a witness to talk a little bit more about his agency's budget proposal and how he might enact that budget moving forward. Any questions on the appropriations progress? And then on the administration side, CMS announced its quote first wave of its health tech ecosystem initiative. This was started in the middle of last year as CMS's goal to create more integrated digital health solutions for CMS programs. And this first wave of product launches includes a Medicare app library, pictured on the right. This is intended to be a directory for Medicare patients of digital health tools vetted by CMS, and is intended to increase more access to those apps for Medicare patients. There is also the launch of what it's calling a health data sharing tool, which would provide the technical frameworks to, quote, allow patients to securely share information with a simple scan on their phone. The fact that CMS is calling this the first wave pretty clearly indicates that there is going to be a number of future launches of initiatives under its health tech ecosystem campaign. The launch announcement also highlighted that over 700 organizations have signed CMS's pledge to participate in its health tech ecosystem. And this is something that there have been meetings at the White House and HHS promoting CMS's efforts to increase digital health access for beneficiaries. Similarly, on the payment and reimbursement side, you may recall back in December, CMS announced the launch of a new payment demonstration model called Access, standing for Advancing Chronic Care with Effective Scalable Solutions. This is a model out of the CMMI, which develops and tests models in a handful of states, and depending on their results, decides whether to expand them nationally. And so the access model is intended to focus on four clinical tracks and provide for outcome-based payments rather than traditional fee-for-service payments, as well as with a focus on digital health and health technology integration in care. And in the announcement of the first 150 participants in this model, CMS noted that most of the organizations have not previously served Medicare beneficiaries and will bring additional technology-supported care options to help people manage chronic conditions. CMS also noted in this announcement that it has extended its application deadline to participate in the model. The model is currently, I believe, in 7 states. And it also has the longest testing period of any model tested by CMMI before, with a period of 10 years. And so those interested in applying to participate in the model have until May 15th. And then the model launches a little under 2 months later in early July. So those were the main updates and conversations going on in the telehealth space. Are there any questions about those or anything we did not bring up that you would like to discuss?
No, that was great, Lydia. I appreciate the updates.
Yeah, great.
In terms of upcoming events, we have two this month. The first being a webinar on Thursday with researchers out of the University of Mississippi Medical Center, talking about some of their research on remote patient monitoring and understanding some of the cost, quality, and program integrity concerns um, that surround RPM reimbursement and how addressing those evidence gaps can help support the expansion of reimbursement for remote patient monitoring. And then later this month, we are hosting a virtual digital health tech roundtable focused on legal, regulatory, and policy challenges impacting digital health innovation. Registration for both of these events is available through your CTeL member portal. And I will also note that tomorrow, our AI working group will be meeting at the same time as well. And so with that, that's all that I have for today. Um, if there are no further questions or comments, then I hope you all have a great rest of your day.
Have a great
You
day.
too, Lydia.
Thank you.